Petra. And I will always imagine your future.
Oh, thank you. Thank you. It's been a long journey since high school and now first year PhD. Crazy.
Yes, but you're built for it. You are built for it. I had a seminar with Canadian Mental Health Association yesterday, and all of the social workers, like there were 70 of them, and one of the techniques they've been using is history. So not just your history, but your history. And think about what your ancestors have been through. Think about what your grandparents have been through. That all of that strength is in you. So that when you're in those moments where you can't feel like you can go on any further, then you tap and you say, ancestors, come down and help me out here.
Exactly.
I'm one of your ancestors, right? Do you want me to tell you a little bit about my history first? Do you want to go straight into the questions?
Yes, go ahead. Yeah,
okay.
Open it up.
So I always wanted to be a school psychologist. And the reason I had been fascinated by school psychology is I always thought I just love school, and not everybody does, right? And when I was in school, I would support a lot of my classmates and even in undergrad, and I wanted to have an area of psychology that was more than the couch. And I always thought of education as an equalizer and as an empowerer. And that's why I love, as a Canadian, so much of our tax money goes to education, because my philosophy is I don't want to lower the bar, I want to raise and help people above the bar. And I know you can appreciate that. If I lower the bar for you, Petra, then I essentially am saying I don't believe in your strengths. And so that if I can teach you what I know, then the work as a school psychologist is very short term compared to other professions. And so, right, so when I started at Huron College, university, which I absolutely loved because the classes were small. And then I went over to main campus and I applied to different schools for graduate school, but Western was the one that I chose in the end. But when I went to graduate school at Western, there was no school psychology. And you are in the, there was applied child psychology, but there was no school psychology.
Yes, so we're very new. They just had their people that just graduated last year. So very new.
That's amazing. And what I did is I created a program in school psychology. And what I did is my mom's also a psychologist, and the interesting thing is she didn't influence me in any way, not till later. We actually worked together later.
Oh, wow.
Yeah, and she ended up she started as a teacher, she started as a teacher, and she really struggled with a particular student, we'll call him Randy, and the school psychologist came in and said, if you really want to know how to help Randy, you should go back to school. So she went back to school at Windsor to do her PhD when she was in her 40s. She had 4 kids at the time. And so this is what I say, Petra, to my students, many of them who have kids, one of the best things you can do as a mother, as a father, is to further your education. Because when you do that, that research does show the more education that your parents have, the more likely you'll be able to. So when I was at Western, what I did is I piggybacked on the clinical psych program. So I figured out, went to the College of Psychologists, figured out exactly what was necessary to become a registered psychologist. I would slide into all the clinical psychology classes. I did my PhD in educational psychology, got all the requirements of the College of Psychologists, including my first practicum was at the Thames Valley School Board.
Okay.
And then my next practicum was at the Lambton Kent District School Board. And because of all of this experience, and I worked with neuropsychs in Windsor, in London too, I got a job as a chief psychologist in a school board at the age of 28, 4 months before I graduated.
Wow.
Right?
That's
so,
amazing.
yes, and that's because of education. I'm telling you, I am telling you right now, this is why I believe so much in you. This is why I believe so much in your classmates. This is why I believe so much in your supervisor, Dr. Jackie, because it's a pathway for everybody. And so now what I did is I practiced full-time as a school psychologist for 5 years. And I moved to Windsor in 2002, and I was laid off from that job, which was a whole nother story. So I went to work at the college, and they needed somebody with a PhD in psychology, because now all nursing programs are collaborative. So you guys have your collaborative with Fanshawe and Western. The school board called me back 3 months later. They found the money to extend my contract. And this was the second board I worked at. And by then I'd fallen in love with education. So I want to make sure you have time to ask me all the questions, but I just believe in all of it, because for me, in order to stay motivated, connected, you think about those days that you want to give up. I want to take psychology. I want to write books, magazines, and I do it. Because it just keeps me, right? So yeah, I'm psychology everywhere. I really believe in mental health education.
Yes. Amazing. Thank you. Thank you. So you shared a lot. So yeah, I'm just going to do a brief interview to understand consultation and collaboration in your field. You can talk about as a current professor, also your time as a psychologist. So what setting? So you briefly did talk about, but yeah, so what setting? You said you were a school psychologist or a chief psychologist?
So absolutely. So I'm registered as a school and counseling psychologist. And so as you know, there are many different areas. And outside this interview, we can explore what areas you're interested in at the college of psychologists, because what happens is that when you get to your oral exam, you have to show specialty. And I did counseling psychology because, and it dovetails nicely, developmental psychology. I have to be an expert in that too, because you have to know what's normal to know what's abnormal. And I teach a course in abnormal psychology. And so counseling psychology, because I see school psychology as helping everyday people with everyday problems, which is very different from clinical psychology. Like, we can work together, but clinical psychology is more acute mental illness. Whereas the way I perceive school psychology and counseling psychology is normal transitions, learning disabilities, emotional problems, stress, all of that. And so school psychology in a lot of ways treats the entire population, as is counseling. So the setting is school, college, university, and community. All age, I'm registered in all age groups, and I practice, I'm on the register of psychologists from '98 until 2016. And one of the reasons I retired my practice in 2016 is because once you practice as a psychologist, you have to hold on to that file for 10 years. You know this, 10 years past the date. And if I had an 8-year-old client, I'd have to have it right? For actually up till they're 18 and then another 10 years. So knowing I probably want freedom in about 5 years, that's one of the reasons I did that. Plus another thing is I really enjoy group settings and I like change. So yes,
good.
Mainly school, basically school of every kind.
Okay, and then so let's talk about one, or I guess we can go all over the place.
Yeah.
So so your position, you hold many hats, correct?
Right.
So so like you said, a psychologist is one, a professor is another one. What's another one would you like to add?
I'd say a psychology author,
okay,
and a psychology speaker, a psychology blogger, I'm in love with psychology. And so I would say my passion is psychology, my purpose is education. And so in terms of what does consultation look like, I'll talk, because it's really important for you because you're active in school psychology right now. So I'll just take it back to when I worked full-time as a school psychologist. It's consultation is everything in school psychology. So that when you go to do a psych assessment, the actual psych assessment, which is, and we talked about this, the skill that you're gaining and able to do the Wechsler and everything that goes with that, that is, I'm going to use, that's money. That is what sets you apart from a social worker, that you will be able to do a controlled active diagnosis. So when and this is what I explain because I teach about this in all my courses, intelligence is a big thing, that the actual psych assessment is probably 15, 20, 25% of the assessment. And why consultation and conferencing is so important in school psychology, and this is why you as a school psychologist, your emotional intelligence is so important, is that you need to be able to win over the teachers, the parents, the custodians, who's ever working out on the yard, because what the psych assessment does is it gives you information, but you need to do a thorough assessment to see that it's validated. So that's where I'd spent a lot of time in the OSR, the Ontario Student Record. So I got to know the principal. So as a school psychologist, I could be going into 5-10 schools a week. And I need to know and every school had a different demographic, a different culture. And as you know, a lot of the schools that it's a lower socioeconomic area. So what tends to happen is I'd have a student that was in grade 5 and had already been to 7 schools. Wow. Yes. And then often that there were, the family was mixed, that maybe it was a divorce, several kids, whatever. So out of anything, your skill set in consultation and conferencing is more important in school psychology than anywhere else. And you'll be great at it.
Thank you.
You're welcome.
Okay. So like you said, it looked like about 15 to 25% assessment, right?
Yes. Yes.
So,
and that said, the assessment, when you write the report, to me, I should say the fun, like for me, the most joyous time was being with the students. Like from, 5 years up to 18. The work is when you're actually writing the assessment. That's a lot of hard work. But yes, the actual assessment part, when I say in terms of communicating a diagnosis, figuring out a diagnosis, think about validity. You want to make sure that it has concurrent validity, that has face validity, that you're finding this child that tests out at a genius level in your assessment, but in the classroom and everywhere else, there's a complete discrepancy. So when I was your age, my first practicum at Thames Valley, the psychometrist, so the master's level, because you can go out and do assessments now. I used to private practice do it at your age. She said, Andrea, I want to think of you like a detective. So if the dots aren't lining up, why is it that the student, we'll call him Bobby, and I did have a Bobby, is got a 140 verbal IQ. Probably we could talk, we'll just say it's all 140, but he's so underperforming. So that's where you have to find out, like, things that teachers don't even see. It could be something as simple as his dog died, nobody talked about it. And maybe he is a student, you could find out that he's the eldest in a family of 5 and his mom works midnights and he basically is the second parent. So that's where the consultation comes in, and it's very interesting. You start to see patterns.
Wow. So you're the one who would have to bring that to like the meeting and make sure to consider everything. Okay.
Yes. And so that's where the emotional intelligence comes in, that you show up with the Timmies for the principal and that you're respectful of the routines, that like say this particular school is better to go there on a Tuesday. So as a school psychologist, we are a visitor, that we are support staff versus now I'm frontline staff as a professor. So the bulk of the money at the college and university goes to professors, but if you just understand the budgets of a school board helps you see where you fit in. So you want to make yourself indispensable. And another way of making that happen is being very timely with your turnaround of reports. That's really important.
Okay. And then you said briefly that you were consulting and collaborating with teachers and principals, and anyone else you'd like to add to that list?
So I would say Children's Aid Society, because that often you'll see neglect. You could see abuse. You might be the first to hear about it because they open up. So think about it with psych assessment. If you're with a child for half a day, this is just sort of a sidebar, it's really important that you warm them up. So sometimes we play basketball, like outside, especially when we're talking with males, it's very hard for them to, we might play Monopoly. And even the assessments I've done with other more at-risk populations, like I bring food, and that can make a big difference too. So in terms of, can you say that again? Just repeat the question.
No problem. Yeah. So just who you're collaborating and consulting with.
So it would be the teachers, the schools, the teacher, principal, parent, guidance counselor. It would be the learning support teacher. And it's so important with them. And this is where I wrote an article for the Drive magazine called Empowering Conversations. And it's so important that you make them the expert. That just by having a Ph.D., Petra, because it can be a trigger for a lot of the people that you work with because they've had negative experiences with authority figures. So that's one of the reasons I'm Dr. D, because it makes it more familiar and it makes it more equal. And so in terms of the consultation, you might have it with the social worker, whoever it is, other schools, but that once again, that you are as much of an observer. So you think about detectives, and if you ever watch a detective show, the best ones are the ones that kind of lean back. And you go in with openness and curiosity. And this is what's beautiful about being new to the field, is that you will go in with open eyes. And right, really open eyes, and that you already know, like when I ask you what your why was, you're there to clear the path for a student that's at risk. And my number one is to help people reach their full potential. And often we think it's simple. So I would have a teacher say this child has a discipline issue. No, that's what on the surface. And think about psychology, we're always going what's under the surface. They haven't eaten, they have moved several times, any of those. So you are essentially consulting with all the schools they went to before, with the parents, with as many different places as you can get information. And the longer you do it, the shorter amount of time it takes. But you just want to always realize that there's a lot of pieces to the puzzle.
Lots of pieces. Okay. Yes, for sure.
And then you'll have like a list of how you go through it. And I can help you with that when the time comes to it. I also have an extra Wechsler assessment sticking around that I'm sure I could, you could have, because I'm like, it's locked up at the school and those are like $2,000. So that you, like officially you can't, but because of the way copyright works, but you're a student. So that's what it's about.
I've been practicing.
Yeah.
Yes, you did mention a huge part is that you need to have emotional intelligence and all like certain skills and qualities and competencies. So what would you say are required for an effective collaboration and consultation?
Excellent listening skills.
Okay.
And at the same time, structure.
Structure, okay.
And the reason structure is so important is because you might be the first person that listened to a parent in a very long time. And if you have a very big heart, you could end up going off task, which is obviously easy to do. And so when I say structure, and I have forms that I've used. So for example, the first part will be the history. The second part will be, say, medication or any of those things. So structure is important. So it's a combination of open-mindedness, structure, and really an ability to make them your teacher. So every time you go into it, they're adding to your education. So that even, how many years? I graduated from Western in 1998, and I'm still learning. So openness, flexibility, structure, discipline. And so when you go into it, like I know this meeting together is 45 minutes, that you let them know ahead of time that we have 15 minutes. And that they know that ahead of time, and then even let them know before the end. So, but most importantly, Petra, be yourself. That is so important. So as you talk about my current job, I teach nurses, health psychology, clinical psychology. So I'm teaching them how to use psychology in the healthcare system. And the one piece of advice I give to them, because it's so easy to lose confidence, and the imposter syndrome is alive and well.
Yes.
Right? And so the idea is that you already know what to do, and think of it as any kind of conversation, and use what conversation skills that have got what you need out of your parents when you need things out of your parents, because you're going in to get mining information while you're making a connection. So imagine every person from your program graduates with the same set of skills, but what makes you unique, like in so many ways, especially because of your particular culture, that you're going to be so much more relatable to certain parts of the population that you work with. For example, in the last 10 years in nursing, they've never had so many males. And so males that in the hospital, it's very vulnerable, like physically vulnerable. And so now they can request a male nurse. It's just a familiarity, a comfort level. And I know myself, I want a female doctor. So that just opens yourself up. So that's very particular about you. And you're also extroverted. Research does show that you're more likely to, you're going to be perceived, because I teach a course called health psychology, and you're going to be more perceived by the patients. This is really about, the entire book's about bedside manner. And research shows that extroverts, nothing against introverts, but extroverts are going to be perceived as more trustworthy by the patients because you're engaging them. So that's a combination of listening and then, you know, just something like the big 5 personality traits that you show up, right? You show up with a smile. And so often people will say, oh my God, Andrea, you're so positive. Like anything's easy compared to a PhD, and that's all I compare it to. But I also, even before this interview, and part of it was, you know, sharing our story on IG stories, is for you. So this is another piece of advice, which I know you already do. But before you meet with the parents, before you walk into the school, before I meet with you today, before I teach, I prepare emotionally. So I will listen to music. I will have a prayer. I will dance. I will call in and say, please help me be a support to Petra. So all of those things that you are doing in order to focus in on being a PhD student, those are skills that will be essential for you as a psychologist, school psychologist.
Wow, thank you.
So this is not anything. So it's like not the knowledge. Yeah, sorry, go ahead.
No, I'm just saying this is rich information. Thank you. Just on it. Oh, wow.
Good.
Okay, so next question. Yeah. So I know you also said like 15 to like 25% you said is like assessment. Yeah. Is there any other percentage for consultation? And
okay, so, if we're going to make it really simple, we'll make it out of 4. So I would say 25% is the assessment.
Okay.
25% is the consultation, which would also include the conference after.
Okay.
So when you communicate the results. And so that would be 25% pre and post consultation, 25% assessment, 25% research. So you're going to be learning on the job. So you'll be able to research the cases, you'll research the school, you'll research, you know, all of these things. And part of that research is the team meetings you'll be having with other staff. And especially as a young psychologist, it'd be wonderful for you to be paired up with another more senior person there. And I will always be that person for you too.
Oh, thank you.
It's true. And then the last 25%, I mean, it could be just part of your self-care. And, you know, just taking care of yourself. So a big part of my work, because I wasn't as aware as you are. It wasn't such a thing, like when I was, you know, how many years ago, is preventing compassion fatigue and vicarious trauma. And so we hear the words burnout. And burnout would be any kind of profession. And secondary trauma is immediate. So if somebody witnessed 9/11, that'd be secondary trauma. Compassion fatigue is caring until it hurts. And vicarious trauma is over time. So I'll give you an example of that, and I'll circle back to this being 25% of the work that you do as a psychologist. That my nurses will talk about when they're doing their, you know, 2nd, 3rd years, they're going to the hospital, they're fresh, they're full of energy. And they'll say, you know, there's some nurses there that refer to the patients by their room number. And the nurses seem detached and cold. And think back to school, you remember teachers that seem that way. And I explained to them, that is actually a coping technique. That they become too attached, and imagine right now, the pandemic, to patients over time, and in order for them to stay in the profession, that's how they detached. And one of the ways that you can care for yourself, and this is how I've learned to care for myself, is this is why I write a blog. This is why I do a blog. This is why I went from full-time school psychology to teaching because variety allows me to have a detachment. Because when you're one-on-one with the client, you can't, you'll be professional, you have that level of detachment, but the younger they are, when the problems, like you just don't feel in charge, like it feels disconnected. Just want to make sure, I think we cut up for a second. Okay, so, just take care of yourself. And know, and know that you're human. Like even as you described everything, like you're human. And if you're in a PhD level, on some level, you are superhuman. You've always excelled. You've always done well. This is where self-compassion is so important, and you connect with other people. So I would say 25% is self-care because you want to stay in it. There are many different ways to self-care, but it's important. And that's why I like psych assessments. I absolutely, out of everything I did, I love consultation, I love psych assessments. I did psych assessments for the City of Windsor through the Learning Disabilities Association right until 2016, because with the psych assessment, there's a natural disconnect. And with the psych assessment, there's a start and there's an end, and you feel very satisfied because you give them a package, you give them an answer. Whereas counseling, it goes on. It's harder.
Sure, for sure. No, that's good. That's good. So like when you, like, let's say when you get into the school, right? And then, so what percentage would you say is like direct contact with like the students?
I would say, okay, so it's 100%. So a high percentage, I should say. It's a lot.
Yeah, relative to the consult and collaboration, it's high.
So the consulting, it's this, okay, let me just stop for a second. What I love best about school psychology too, I love so much about it, but there's so much variety. But when on any given day, so how it worked for our school boards that I work with, you get a family of schools. So I say had a family of 5 schools. And so our Friday was set aside for writing reports. And so how it would probably work for 3 weeks, so all those 4 days, I would go into each of the schools, and then the next week I go to each of the schools and I get a different kid. And then probably the 4th week I do all of the feedback. But when I'm in that school that day, because the structure is so important, I go in there to test. I go in there to do the assessment, which might include observation and all that kind of stuff. But I don't know how to break that down because I said it was 25 and 25 and 25, but you're.
Okay, I was just wondering comparison.
No, it's great. It's great. Yeah. Like it's. If I were just to say in general, not philosophically, I would say in general that with the time that you're doing the assessments, and this is what is really important. This is why, as a psychologist, it's 3/4 of the time you're in the school, you're doing assessments.
Okay, so.
And I love it because you're going to you're just driving around, you're going to different schools, and there's so much variety.
Okay.
Yeah.
And then which professionals do you collaborate with the most in your practice? So I know you said teachers, social work, Sky. So I think we've kind of talked about that one already.
Okay, that's okay.
Yeah, and then I think are there any, you already mentioned this too, are there any benefits working with other professions? So are there yeah, there we go.
There's so many benefits. I'm just going to step back for a second. You see social media. And on social media, but I'll answer your question. Everybody's self-diagnosing. Everybody's coming up with just surface level ideas of things. What makes psychology and a PhD, what separates it from everything else is that you see an issue from 100 different angles. And one of the reasons that you see the issue from 100 different angles is because this is the benefit. You work with so many professionals. So sometimes I might work with a neuropsychiatrist, sometimes I might work with a physician, sometimes I might work with a social worker. So what it always does, it gives me a fresh pair of eyes. So often you see what's happening in this past year, and we'll address it, Petra. It's with the racial unrest, the Black Lives Matter. You see it from so many incredible perspectives, and you have educated me. And that's part of conferencing and consultation, is you bringing that to the mix. And that's what consultation and conferencing does, is it allows me to just sit back and say, how does Petra see it? How does her mom see it? How does, I've worked with a lot of student leaders that are Black, you know, how do they see it? Because this is alive and well. This is going to be a big part of your work, educating around Black Lives Matter, how it impacts the students in the classroom. And so it's just an example of how, even for you, it's hard because you think, why don't you see what I see? Mm-hmm. And so your job, your life mission is to help me see it the way you see it. And that's what you have been doing. And I know that's the evolution of your platform, you know, when you're not studying. And so you are a consultant for me, because you get to show me through your eyes. And so one of the most important things, especially for me as a professor, is that I remember what it was like not to know. And so that's where the compassion and all that comes in. So that's where I'm back to the Dr. D, that I have to make sure if I'm conferencing or consulting with a parent, I'm not there to dictate. Yeah. I'm there to find out, you know, what is missing. So that really, a lot of times when we talk about what looks like a clinical anxiety disorder, because you could be doing some kind of assessment around that, they don't have clinical anxiety. They have an inability to cope with failure, and they've never been given the toolkit, because you just watching the parents, you see they protect the child at every turn. Whereas you could have the same child that's just thrown into it, but with support. So consultation, conferencing allows you to just like add different layers of perspective to your work.
Perfect, thank you. And then another one, so those were the benefits. Are there any challenges that you faced? And if so, what are they? How would you approach it?
Excellent, excellent. Time. It takes a lot of time, and that's why structure is really important. And that's where you do wear the Dr. Dinardo hat. So there's a time to be Dr. D, and there's a time to be Dr. Dinardo. And so that you have a very limited amount of time for certain things, because you maybe only get a hold of that parent for that one moment, and you like, even on a sheet of paper like this, these are your questions. That you might that you have one, which I absolutely love. See, you're already doing structure right here. So you have all these questions, but you know that there's only one question that needs to be answered. So time, so this is where you step into your power. And I know with Petra that you know how to step into your power. So there's a time to be Dr. P, and then there's a time to be full-on Ph.D. Okay, so so time. Another thing is that there will be a lot of times they don't want you in that school, so that it could be something that's happening in the school. It could be the psychologist before you. It could be all these things. So it's very important that you are able to not take things personally. And part of not taking it personally, because say if you have 4 schools, you know, 3 of the schools, they might roll out the red carpet for you, like they might be buying you the coffee. And the other school, you're just a pain to them because they have other stuff going on. So you just know it, you accept it. It's like being a professor, and your professors will be getting these answers here too, that they know that if they struggle with a certain class, well, there's always next semester. So the next challenge is that be prepared not to be liked. Be prepared to communicate information to teachers and parents. Like, they all have different stakeholders. And this is the biggest challenge. Okay, I'll tell you what the biggest challenge is that you have, okay, we'll make it, this is Johnny, okay? This is Johnny right here. There's you. And this was actually one of the questions in the College of Psychologists oral exam, like, who's your client? Right? Because the school board hires you, not the parent. So this is where conflicts of interest, et cetera. And the way I see it, Johnny's is the client. So what will happen is, more often than not, they do an assessment because they want Johnny out of the classroom. Johnny's disruptive, Johnny's difficult, any of those things. So they're hoping your assessment will say, get Johnny into what we call a section class or CPRI or any of those special programs. And so you have to stay neutral. And always, just like you are, when I asked you your why, I would take a picture of Johnny and I would put a picture of Johnny in the middle of the conference room, and I'd always bring the question back, like everything back to Johnny. So that the principal has their agenda, the teacher has their agenda, the parent has their agenda. You have Johnny's agenda. And if part of that preparation for going in is knowing that your results aren't going to be celebrated by everybody. And this is another thing that I would really emphasize. And when I was the head psychologist, when I worked for a school board, I reminded my staff often, in the course of 5 years, you might do it, I'm just giving you a number, 1,000 psych assessments, but this Johnny gets 1. So you want to make sure that you put everything in that you can, which I'm not worried about for you, and that that it's like their very first time, like every time you do assessment, it's like the first time you ever did it, fresh eyes, all of those things. And I keep this in mind, especially as a professor now, because I have first years that are very nervous. Think about your first year PhD, all of that, and you want to make sure you're just, from your professors, you're just not another student. You want them to honor your experience. So you'll be great. It's like, it's the best experience ever. I loved it. I absolutely loved it.
So you would say, like, for recommendations, just making sure that you remind yourself that Johnny is the client, or that.
Yeah, Johnny's the client. Johnny is the client. And this is where I would also encourage you, when you're hired by a school board, you can also do private practice, and there are many, when we get, there's so many options there. I started my own clinic, my own private practice when I was your age, and I used to do psych assessments with the psychologist. But that this is really a conversation to continually have with other psychologists in the school board. And even with you can go to the principal, you can go to the superintendent or whatever and say, I am here. And even the college of psychologists, this is where you call the college of psychologists and say, I'm in a conflict here. Can you walk me through it? Because it's an ethical dilemma. But Johnny's the client. The way I see it is Johnny's the client. He needs protection.
Mm-hmm. Yes, good. And then lastly,
yes.
I know you put a lot of nuggets of wisdom here and there, just maybe in summary of like any tips for someone like me on to have like a successful consultation and collaboration in the school setting, and then maybe a little bit outside of it as well.
Number 1, and this is reiterating what you already do, write down your 3 intentions for the consultation before you go. So what do you want to learn? What are the 3 goals? Structure, because I always think the more structure you have, which I'm going to hold this up again, which is excellent, and if you can communicate that structure ahead of time. So when I do a keynote presentation, I get my slides to the audience ahead of time so they know what to expect. And that when you're in the meeting, that you be as present as possible. And this is what COVID's teaching you anyway. So that presence, because you are going to gain more, because say that you have, say, a consultation meeting with the parents present, the learning resource teacher, the principal, everybody, watch them. Watch how, even before, if you can observe it, how the parent interacts with the child. You can get a lot with the nonverbal communication. Is it encouraging? Is it, negative, whatever? Watch how the teachers interact with the principal. Is it a principal that's respected? Is it a principal that's dismissed? Basically notice the power dynamics as you're going in. And then see like how seasoned the teacher is, because the teacher can teach you so much. Like they are the frontline staff. So you might have a teacher that is completely burnt out, and that's where your compassion comes in. How can I support you? So that's when I do the consultation. I would start with, what can I do that will make your job easier? And that's a wonderful way to win them over, because ultimately, at the end of the day, that you want everybody rooting for Johnny. So you're going to come in and give them a fresh perspective. And then also think about yourself, that of all the years that you've been in school, what would have made your life easier, even now? If someone came in and said, you know what, I'm a consultant and I'm first year, I'm going to interview Petra. What I'm going to ask you right now, what's one thing that your professors could do that would make you feel more, I'll say, at peace? Because when you're at peace, then you can learn. What are some things that make you feel supported Because that's what you want to do. You want to make sure they feel supported.
I think that's a really great question. I think it's just really like challenging right now because they're very like, I don't know anything too with like pandemic. We're changing things left and right. One of my professors on the day of had to rechange our whole course. So it's just very like, they're like have tense and then that passes on to us because we're tense. We need enough hours. We need this placement. So it's a lot. So just like they've been trying their best. And so we understand that. And so for them to have compassion too, to understand that we're trying to, more check-ins would be nice. You know
okay,
what I mean?
I like the check-in.
Yeah.
I like the check-in. And I also hear from you that if they're transparent about it,
yes.
you know, transparency, because I'm going to tell you right now, as a professor, I signed up for a brand new course I'm teaching right now. And Petra teaches. I'm normally very structured, all of this, but I made a lot of mistakes this week. And because of the pandemic, in my life, I've been never so self-compassionate. Usually I'm like awful to myself. This is what we do. We're really awful to ourselves, which I'm sure you are. And so my students are letting me know. And now my reaction is completely different. I say to them, thank you, like sincerely, thank you. I need, because for example, I had something add up to something out of 120% instead of 100. So the benefit was they had one less assignment. So that there's some humor, there's some check-in. So what I like to do is every few days I'll send them a little video that reminds them. So I like that.
I wish we had that. No, that's awesome.
All those things, but also when it's appropriate, when it's comfortable, tell them that reassurance is more important now than ever because it takes a little bit. And guess what? That's what you will do for your students because you will also be a school psychologist and an adjunct professor at Western one day. That's what I see.
Ah, thank you. Yes, well, this concludes my like interview. I've learned like a lot, like my pages are like all over, you know, and you're just dropping everything. Like it was just amazing. So thank you for like taking the time to talk to a student like me and just sharing your like past experience, which is like incredible. Thank you.
It is destiny and is my absolute pleasure. And thank